Joining us live is Professor Adam Guastella, Michael Crouch Chair and Child and Youth Mental Health at the University of Sydney. Great to see you, Professor. Do you mind just briefly telling our audience about the work that you do?
So I work at the University of Sydney, the Clinic for Autism and Neurodevelopmental Research. Our work is all about embedding evidence-based practices in health services and community services to improve life outcomes for children and families. So we do a lot of clinical trials, we develop innovative assessments, and we work very closely with service providers to make sure that children get the best start to life.
All right, and Professor, insiders are calling the discussion a complete disaster. What are you hearing from businesses and families?
Look, I think there firstly is recognition that the principles of thriving kids are good and appropriate, and that we really want a good system that supports our children and families. I think where we are at the moment, though, is there's a lot of uncertainty about what thriving kids will look like, and we're only 7 months away from our implementation of at least the start of the program. So I think it's an ambitious timeline, and there's a lot of concern about the details of how children will be selected into Thriving Kids, what are the supports that they're going to be provided with, and how the assessments are going to be managed across time. So I think that's where we're at the moment. What I do know is the government has been very active in consultations with lots of people over the last couple of months. They've set up committees, and those committees are overseeing the decisions that are being made. It's an incredibly complex process, so I'd expect some details about Thriving Kids to come out shortly, and I think that will hopefully allay some concerns.
And from your expertise and what you're seeing and hearing, what would you like to see?
What we really need is a system that's responsive, that doesn't repeat the mistakes that we have with the NDIS, where there are long wait times for entry. Regional disadvantaged communities often miss out from services, and we need high quality supports for children and also their families. So I think that what I would want to see is a system that's been well thought out and planned, has got a good strong evidence base around its implementation, and most importantly, has tracking measures within it so that we can ensure that children are getting the supports that they need and the families are being supported in that process as well.
And Adam, how are families feeling about this?
Look, I think for the families that are already receiving NDIS supports, there's a lot of concern. And there's a lot of concern that the system that they've worked hard to enter and to navigate, that's providing support, will be lost, and there won't be a system to replace it. I think that's normal in the context of a new initiative that is complex and hasn't been announced. And so we have to wait and see, and I think have faith that the government will deliver on a system that's still going to continue to support families appropriately. For those that are outside the NDIS, I think there's a lot of uncertainty about what supports will look like, how they'll enter the scheme. And for businesses in particular, I should say, that are currently providing services, I know there's a lot of anxiety around whether they'll be still operating under the similar framework come July.
And just finally, we've got about 30 seconds, if you don't mind, Professor. In a general sense, the diagnoses of autism, are we seeing an increase, and what can you tell us in that space?
Look, it's an incredibly controversial area. There's no doubt there's been an increase, largely due to increasing awareness, better systems of support, and changing definitions of neurodevelopment. And we're getting more sophisticated in our assessment of delay. I think the issue is we need to make sure that we provide assessments and supports to our children that need it and improve their life outcomes. And that's the main goal of Thriving Kids.
Professor Adam Guastella, thank you so much. Always great to see you.
Thank you.